Joining us now from Southwest Virginia, we're pleased to have E.W. Tibbs. He is the president and CEO of Centra Health, and he's a member of the Virginia Hospital and Healthcare Association's board of directors. So this guy's like a big deal. And Centra operates hospitals in Bedford, Lynchburg, Farmville, and Gretna. A quick note to our listeners. We were scheduled to have EW on our show last week on Thursday, but I had some technical issues, and so we apologize for that, and we're grateful to have EW back today. Sir, thanks for being with us.
Good morning, John. Thanks for having me today.
Now, as I understand it, EW, you're a Bedford County native, so you kind of know the area that we're going to be talking about today. And you're right there in Virginia's southwest heartland between Lynchburg and Roanoke. And as everybody knows, rural Virginia is a beautiful place, but it's also a place right now economically of great challenges. Unemployment is up, and access to quality health care has diminished dramatically. As a leader of a healthcare system based in rural Virginia, what are some of the issues out there, sir?
You know, rural Virginia is a wonderful place with a vibrant culture and incredible people, and it's not immune from challenges. In some ways, it's actually more susceptible to those challenges and pressures. And for instance, unemployment has declined across the state since the Great Recession, but if you look at the rate, it's generally higher in communities both south and west of Richmond. Hospital and healthcare jobs continue to be an economic bright spot as really one of the few growth sectors in Virginia in 2014, and 1 in 9 jobs in Virginia are in healthcare. It's about 11% of the workforce. Hospitals today employ about 115,000 people across the Commonwealth in good-paying jobs, and they generate billions for the state economy. Those numbers, while impressive, are really just part of the story, and just to get right down to it, hospitals are not on easy street. We face serious challenges, and those challenges threaten public well-being and the economy. When you consider that Virginia has more than 100 hospitals, about a third of them had negative operating margins in 2013, and even more troubling, 20 out of the 37 rural Virginia hospitals operated in the red that year. Rural hospitals are some of the biggest employers in their community, and in fact, healthcare is the top employer in about 82% of rural Virginia counties, and the hospital operations stimulate the local rural economies even more because they hire many small businesses like electricians or construction crews and even more. And each of those small businesses employ local people and contribute to the local economy. So if our rural hospitals struggle financially and have to make difficult choices, that ripple effect really harms all entrepreneurs.
Well, look, there's no question, and this is an issue that we're trying to bring to everybody's attention because it's off the radar screen. Rural hospitals in Virginia today are under fire. They're operating in the red. As you mentioned, EW, they're responsible for thousands of jobs and everything that goes with those jobs, as well as just being able to have access to care. Each one of these hospitals, when they shut down, or, you know, even if they don't shut down, many of them are shutting down particular services because they're trying to stop the bleeding financially, so they can't offer the same services they had, which means that if people are in trouble or they need that service, they have to drive further, which puts them at risk. So you've got the whole economic thing going on. You know, it sounds like what you're saying is hospitals are at the heart or are the heart-pumping economic blood to the communities they serve. So the obvious question is, what happens if the heart develops problems? These hospitals are operating in the red. Why is that happening, and how do we change it?
Sure. Warning signs are already there. And if you look, last week, Governing Magazine had an article explaining really the stakes, and I encourage all your listeners to read it. The article talked about 2,300 or so rural hospitals in the country, and most of those are in the South and Midwest. Specifically, what that article lays out is that these hospitals are struggling to survive, and the reasons for that are many. One is that Congress has cut Medicare spending in recent years, and that's in addition to the Affordable Care Act changes and reductions. And each of those things hurt all the hospitals, but they're particularly problematic for the rural providers because their patients are often older than those in more urban or suburban areas, so they tend to be much more reliant on Medicare payments. And hospitals get reimbursed pennies on the dollar for Medicare and Medicaid patients they treat. in sparsely populated areas like our rural communities, the local hospitals often see fewer patients, but they still need to maintain emergency rooms and specialty services that each of their communities need. And providing that level of care, it comes with cost, and those costs can be heavy for rural hospitals, which serve many people who are uninsured and just simply can't afford to pay for the treatment that the hospitals provide. Maintaining that level of service, it's part of the hospital's mission and really their community necessity. People want the hospital's lights to be on and the doors to be open with highly trained professionals when they or their family member needs life-sustaining or life-saving care. And I can tell you we take that very seriously here at Centra. And in fact, Lynchburg General Hospital, we have the second busiest emergency room in the state, so there's clearly a need.
What is the number of patients that come in without insurance into the emergency room for indigent care? Is that higher in your hospitals in the rural area? And if it is, how do you deal with that?
Sure. So all of our hospitals are business operations, and we expect and do run them efficiently. And one of the things that really leads into your question and what makes healthcare and hospitals different than other businesses is that we're legally required to give our services for free. And I'm hard-pressed to think of another industry that operates under those conditions. A federal law that passed in 1986 requires hospitals to treat patients that come to our emergency room regardless of their ability to pay. And don't get me wrong, hospitals and health systems are not complaining about that. It's what we do. We care for our communities. That said, it's just undeniable that those situations have real cost. If you look across the Commonwealth, there was about $1.5 billion in shortfall from revenue from the uninsured or uninsured patients between uncompensated care and that shortfall. The rural Virginia hospitals serve a population on average that's about 75% Medicare and Medicaid, which is very different than those urban and suburban areas. And if you look at the overall population in these rural markets, about 17% of that group has commercial insurance. So said another way, Virginia rural hospitals are underpaid for treatment provided to about 3/4 of their patients. And that's just an unsustainable model, and it's due to governmental rules that are affecting the hospitals, not mismanagement or poor oversight.
Look, that is an unsustainable financial model, and I think you're at the issue of what's actually happening. Now, look, I would venture to say that almost everybody listening to us right now agrees that you have to have hospitals everywhere. They have to have the access to people, not only for the things that we mentioned, but we've also said that they're the number one or one of the leading jobs creators. Many people listening would also say it sounds like hospitals are facing, especially in these rural areas, tough situations. But some might say, well, that hospitals are a business, and it's a job of business and its leaders to make sure the operation runs efficiently and prudently. So how do you respond to that?
Sure. So in addition to my prior comments, I would say we've got to do a good job as an industry and as hospital operators to remind our policymakers and the public about the vital benefits of hospitals, educating them about the real problems that we're dealing with, and from there facilitate conversations that lead to compromise and hopefully produce positive outcomes for Virginia. And that means protecting access to care. It means protecting good-paying jobs, local and state economic support that the hospitals provide. And John, you mentioned I'm from Bedford County. I come from a family of nurses and healthcare providers, and I can tell you firsthand about the fantastic career opportunities that healthcare has provided for me and my family. And I imagine there are countless stories like that in families across Virginia. And if we want to preserve that legacy of economic empowerment for future Virginians, people must understand that neglecting hospitals' issues, it jeopardizes us all. And our elected leaders across the Commonwealth rightly devote time and energy to economic development on behalf of their constituents. And our message is that hospitals have been and really continue to be key economic engines and jobs providers. And that said, our stability is threatened if lawmakers don't acknowledge and address the harmful effects of reimbursement inadequacy and uncompensated care. And look, the hospitals want a solution, and we believe there's a solution to be found among people of goodwill and in both parties who care about their fellow Virginians. And what form that solution takes remains to be seen. You know, hospitals and health systems didn't ask for the Affordable Care Act, but it's the system we have. And what's important now is taking the critical first step of getting everyone to recognize the problem.
Well, that's always the number one thing, is getting people to see it. That's why we've been trying to alert our listeners that there's no really easy answer because, look, you've given us the diagnosis, obviously. So what is your recommendation? How do we get this mended? Now, obviously, one proposed solution was Medicaid expansion. That's been debated by the Virginia General Assembly for some time. There's been no progress on it. Other states that have adopted it, when you look at other states that adopted Medicaid expansion, EW, or something similar to that, has that made a difference?
Sure. There's a situation, I would say, John, that's really being created between I would call the haves and the have-nots. And when you look at those states that have expanded their Medicaid programs, whether that's to address what I call payment inadequacy, meaning that the rates that providers, physicians, and hospitals and others receive to take care of someone who is a Medicaid recipient, or whether that has to do with the ability to expand a program such as Medicaid. It's really about trying to ensure that there are access points that are appropriate both from a quality and a cost standpoint. We as a hospital and healthcare association, we as an organization, Centra, here in Central Virginia, very much value our relationships with our state and local government officials. We're working hard with them as our partners to come up with a solution that is sustainable, and we're hopeful for the future with that. That said, in no way does that remove our obligation to run a highly efficient organization at Centra. We certainly expect to be in the top quartile nationally from a comparison group of other excellent organizations, whether it's in productivity or patient satisfaction, quality, etc. And we strive every day to be better. So this thing at the end of the day comes down to relationships and working together to build healthier communities, and our hospitals and our health systems are at the center of that. And we've just got to find a way to make sure that message crosses the aisle and that we remember why we're all here, and that's to serve the community.
Well, look, I appreciate that, EW, but the bottom line at the end of the day is, here's my question. If the General Assembly doesn't do something that would increase the dollar amounts going into rural hospitals, like the ones that we mentioned, that you're able to run. If we can't solve it and it stays stagnant, what happens?
What happens is services go away and doors close.
That's the bottom line.
The bottom line.
So we can see.
And whether that happens in Central Virginia, Southwestern Virginia, Northern Virginia, or Eastern Virginia first or next, first isn't the right term. We've already had closures in this state.
Right.
So it's not a matter of who's first, it's a matter of who's next.
Exactly. So the bottom line is, when all the ideological debating is done,
correct,
we can debate Medicaid expansion, and everybody's got a side to that, and whether or not the federal government should get involved. When it's all said and done, inaction is going to shut down hospitals in Virginia. Inaction is going to shut down availability of medical services in Virginia. And so as we go into the General Assembly in 2016, basically the General Assembly has to come up with an answer for this. Am I right?
That is correct. And again, I can say, John, that the Virginia Hospital and Healthcare Association is working very hard. Our staff and our board, we want to be part of the solution, and we absolutely believe that inaction is indeed inaction. So if there is not action, then that indeed is charting a course, and it's not a course that we believe as leaders in the industry and our responsibilities to our community is an acceptable one.
Sure, EW, and I just want to reiterate one thing that we said earlier that I guess gets mixed up in this debate, is because, as I said earlier, there's some people who say, well, it's a business, go figure it out. Well, that's not really true. Because
right,
as you said early on, EW, if somebody comes into the emergency room, you have to provide the indigent services for free.
Correct.
That tends to go up in rural areas. The percentage is higher. The cost is higher. There's also limitations on what you can charge under Medicare and Medicaid also, so that's being squeezed down. So it's not like you're and then you've got all the issues that go with Obamacare that comes with that. So it's not like you're operating a business in a free market environment where you can decide what products and service to offer, where to put your plants. I mean, everything is dictated by providing medical services for the areas, and now you're being squeezed, and we have to do something. Is that right?
That is correct.
All right. Sounds like I've summed it up. EW, we want to thank you for your time and for being with us today. E.W. Tibbs, President and CEO of Centra Health and a member of the Virginia Hospitals and Healthcare Association.